Nature's Healing TV presents What Hospital Won't Tell You About Your Health. The truth about natural healing, prevention, and what your body really needs. Have you ever wondered why so many people take medications every day, yet still feel tired, inflamed, overweight, anxious, and sick? Why do millions of people spend thousands of dollars on hospital visits, prescriptions, and treatments, but never truly get well? And why is it that some of the most powerful healing secrets have been known for centuries, yet are rarely discussed during a typical medical appointment? Today, we're uncovering what hospitals often don't tell you about your health. This is not about attacking doctors or modern medicine. Hospitals save lives every day. Emergency surgeries, trauma care, antibiotics, and critical treatments are among humanity's greatest achievements. But there is another side of health that receives far less attention. A side focused on prevention rather than treatment, nutrition rather than symptom suppression, daily habits rather than dependency, and understanding how your body was designed to heal. By the end of this video, you'll discover the truth about why chronic disease is increasing, traditional health wisdom used for generations, natural methods that support healing, the pros and cons of both modern and natural approaches, practical steps you can start today, and most importantly, you'll understand why your greatest doctor may already live inside you, your own body. 1. Hospitals are designed primarily to treat disease, not teach prevention. Most hospitals excel at managing emergencies, broken bones, heart attacks, severe infections, accidents, complications that require immediate intervention. And for this purpose, hospitals are essential. But hospitals are not structured to provide extensive education on nutrition, sleep, stress reduction, and lifestyle. A typical consultation may last only a few minutes. The focus is often on diagnosing a problem and prescribing a treatment. That treatment may be life-saving, but it may not address the underlying reasons the illness developed. For example, high blood pressure may be linked to excess salt, obesity, stress, and inactivity. Type 2 diabetes is strongly associated with insulin resistance, poor diet, and abdominal fat. Fatty liver disease is commonly related to sugar intake, obesity, and sedentary habits. Acid reflux may be worsened by large meals, obesity, and certain foods. Medication can help control these conditions, but prevention and lifestyle changes can often reduce their severity and, in some cases, significantly improve outcomes. That is one of the biggest truths many people never hear. 2. Your body has powerful self-healing mechanisms. The human body is extraordinarily intelligent. When you cut your skin, it repairs itself. When you sleep, tissues regenerate. When you eat nourishing foods, cells rebuild. When you reduce stress, hormones rebalance. When you hydrate, organs function better. This natural capacity for repair is real, but it depends on whether the body receives what it needs. Clean water, nutritious food, quality sleep, physical activity, emotional stability, fresh air, sunlight, rest. Without these foundations, healing becomes more difficult. Many traditional healing systems recognize this long before modern science. 3. Traditional knowledge has long emphasized food as medicine. Across Africa, Asia, Europe, and the Americas, communities used natural foods and herbs to support wellness. Examples include ginger for nausea and digestive discomfort, garlic as a culinary ingredient with antimicrobial properties, turmeric for its anti-inflammatory compound curcumin, bitter leaf and moringa as nutrient-rich foods, honey to soothe sore throats, hibiscus tea to support cardiovascular health, fermented foods for digestive health. Modern research has validated many of these traditional uses. However, natural does not always mean harmless. Herbs can interact with medications. Some remedies may be contaminated or improperly prepared, and certain conditions require urgent medical care. Traditional wisdom can be valuable when used responsibly and in combination with evidence-based medicine. 4. Many chronic diseases are closely linked to lifestyle. One of the most important facts about health is that daily habits have enormous influence. Conditions commonly associated with lifestyle include obesity, type 2 diabetes, hypertension, high cholesterol, non-alcoholic fatty liver disease, sleep apnea, some heart diseases. Contributing factors may include excess sugar and refined carbohydrates, highly processed foods, poor sleep, chronic stress, smoking, excess alcohol, physical inactivity. No pill can fully replace healthy living. Medication may be necessary, but lifestyle is foundational. 5. Food choices affect your cells every day. Every meal sends signals to your body. Some foods promote inflammation. Others help nourish and repair tissues. Foods that support health include vegetables and leafy greens, fruits, beans and legumes, nuts and seeds, whole grains, fish, eggs, plain yogurt, adequate water. Foods to limit include sugary drinks, ultra-processed snacks, excess fried foods, excessive alcohol, large amounts of added sugar. Food is not magic, but over time, consistent choices can profoundly influence health. The food you eat today becomes the cells, hormones, enzymes, and immune defenses that protect you tomorrow. That is a truth every person should understand. 6. Sleep is one of the most powerful medicines. Hospitals may prescribe medications, but few people fully appreciate the healing power of sleep. During sleep, your body repairs damaged tissues, balances hormones, strengthens immunity, consolidates memory, regulates blood sugar, removes waste products from the brain. Chronic sleep deprivation has been linked to weight gain, high blood pressure, diabetes, depression, poor concentration, weakened immunity. Traditional cultures often respected natural rhythms, sleeping shortly after sunset and rising with the sun. Modern life, however, exposes us to screens, stress, and late-night eating, all of which can interfere with restorative sleep. Natural ways to improve sleep: maintain a consistent bedtime, avoid caffeine late in the day, limit screen exposure before bed, keep your room cool and dark, avoid heavy meals late at night, practice prayer, meditation, or deep breathing. Sometimes, better sleep can improve health more than another prescription. 7. Stress can quietly damage the body. One of the greatest hidden threats to health is chronic stress. When stress becomes constant, the body produces high levels of cortisol and adrenaline. Over time, this can contribute to elevated blood pressure, belly fat, digestive issues, anxiety, insomnia, low immunity, hormonal imbalance. Many people treat symptoms without addressing the stress beneath them. Traditional healing systems often emphasize peace of mind, community support, and spiritual practices. Modern science now confirms that emotional well-being directly affects physical health. Effective stress reduction practices, prayer and spiritual reflection, deep breathing exercises, walking in nature, journaling, exercise, gratitude practices, meaningful social connections. A calm mind is not just emotionally beneficial, it is biologically healing. 8. Exercise is a natural prescription. Movement is one of the most powerful forms of preventive medicine. Regular physical activity can improve circulation, strengthen the heart, increase insulin sensitivity, reduce inflammation, boost mood, preserve muscle and bone mass, improve sleep. You do not need an expensive gym membership. Walking, stretching, gardening, dancing, and bodyweight exercises can all be effective. Traditional lifestyles naturally included daily movement through farming, walking, and physical labor. Today, many people sit for most of the day, and the body suffers. Motion truly is medicine. 9. Sunlight and fresh air matter more than many realize. For generations, people spent significant time outdoors. Sunlight supports vitamin D production, which is important for bone health, immune function, muscle strength. Fresh air and natural environments can improve mood and reduce stress. Modern indoor lifestyles may contribute to low vitamin D levels, fatigue, poor mood, reduced physical activity, moderate sunlight exposure and time. Outdoors can be a valuable part of a healthy lifestyle. 10. The gut plays a central role in health. The digestive system affects far more than digestion. The gut microbiome influences immune function, inflammation, mood, nutrient absorption. Helpful practices include eating fiber-rich foods, consuming fermented foods such as yogurt and kefir, staying hydrated, limiting excess sugar and ultra-processed foods. Traditional diets rich in vegetables, legumes, and fermented foods often supported gut health naturally. When the gut is healthier, many other systems function better. 11. Hydration is fundamental. Water is essential for virtually every process in the body. It supports kidney function, digestion, temperature regulation, circulation, cognitive performance. Even mild dehydration can contribute to headaches, fatigue, and constipation. Many people underestimate how much better they feel when they consistently drink enough water. 12. Hospitals often focus on symptoms, while lifestyle addresses root causes. This is not a criticism, it reflects how healthcare systems are structured. If you arrive with dangerously high blood pressure, medication may be necessary immediately, but long-term improvement often requires weight management, dietary changes, stress reduction, regular exercise, better sleep. The most effective healthcare combines appropriate medical treatment with sustainable lifestyle habits. That is where true transformation occurs. 13. The pros and cons of modern medicine. To understand your health fully, it is important to appreciate both the strengths and limitations of modern healthcare. The advantages of modern medicine. Modern medicine has saved countless lives. Hospitals are indispensable for emergency surgeries, childbirth complications, severe infections, traumatic injuries, heart attacks and strokes, advanced diagnostic testing, cancer treatments, intensive care, vaccines, antibiotics, anesthesia, and imaging technologies are among the greatest medical breakthroughs in history. When used appropriately, medications can lower blood pressure, control blood sugar, relieve severe pain, treat infections, stabilize mental health conditions, prevent life-threatening complications. These are extraordinary achievements. The limitations of modern medicine. At the same time, modern healthcare often faces important constraints. Appointments may be brief. Nutrition and lifestyle counseling may receive limited attention. Some medications can cause side effects. Chronic diseases may be managed rather than reversed. Patients may become dependent on treatment without addressing root causes. The issue is not that medicine is ineffective. The issue is that no healthcare system can replace the impact of daily choices. Hospitals can intervene during crises, but your habits determine much of your long-term health trajectory. 14. The pros and cons of traditional and natural remedies. Traditional remedies have served communities for generations and continue to offer valuable insights. Potential benefits, often based on centuries of practical experience, may provide nutrient-rich foods and herbs, can complement healthy lifestyle practices, frequently emphasize prevention and balance. Potential risks. Scientific evidence may be limited for some remedies. Dosages are not always standardized. Contamination or adulteration can occur. Herbs may interact with prescription medications. Serious conditions may require urgent professional care. Natural approaches can be helpful, but they should be used thoughtfully and responsibly. The wisest approach is to combine traditional knowledge with modern evidence and medical guidance when needed. 15. The most profitable healthcare strategy is prevention. One of the most powerful truths about health is also one of the simplest. Preventing disease is often easier, safer, and less expensive than treating advanced illness. Prevention includes eating whole, nutrient-dense foods, maintaining a healthy body weight, exercising regularly, sleeping adequately, managing stress, avoiding tobacco, limiting alcohol, attending appropriate health screenings. Many chronic illnesses develop gradually over years. Likewise, healing and recovery are usually the result of consistent daily decisions. Your breakfast matters. Your sleep matters. Your thoughts matter. Your movement matters. Your choices today shape your health tomorrow. 16. Warning signs your body may need attention. Your body often sends early signals when something is out of balance. Examples include persistent fatigue, frequent headaches, digestive discomfort, and unexplained weight changes. Poor sleep, elevated blood pressure, increased thirst or urination, brain fog. These symptoms can have many causes. Rather than ignoring them, consider both medical evaluation and a review of your daily habits. Early action can prevent more serious problems later. 17. A simple daily health blueprint. If you want to support your body naturally, start with these foundational habits. Drink adequate water. Eat more vegetables, fruits, legumes, and whole foods. Reduce excess sugar and ultra-processed foods. Move your body every day. Sleep 7 to 9 hours per night. Spend time outdoors. Manage stress through prayer, meditation, or relaxation. Nurture healthy relationships. Attend recommended medical checkups. Listen to your body. These habits may appear simple, but their cumulative effect can be profound. 18. Final thoughts. What hospitals may not always have time to tell you is this: your body is remarkably resilient. Health is built daily. Prevention is powerful. Food is information. Sleep is medicine. Movement is therapy. Peace of mind supports healing. And small habits, repeated consistently, can transform your future. Hospitals are essential when illness becomes severe. Doctors and nurses provide life-saving care, but the greatest investment in your health begins long before you enter a clinic. It begins in your kitchen, in your bedroom, in your thoughts, in your daily routine, and in the choices you make every single day. Your body has an extraordinary capacity to repair, adapt, and thrive when given proper support. Respect it, nourish it, protect it. Work with qualified healthcare professionals when needed. And remember this powerful truth: the best healthcare is not only what happens in a hospital, it is what you do consistently to care for the body you live in every day. Follow Nature's Healing TV for more. This video is for educational and traditional knowledge purposes only, and it's not a substitute for professional medical advice or diagnosis. So be warned.